Hi, and welcome to week 5 of Cardiac Interventional. Today we're going to talk about the diagnostic studies that occur in the cardiac cath lab. And here's a list of them here. And these come directly from the cath lab or cardiac interventional content specifications from the ARRT, so that's where this list comes from. But first, just briefly want to do a couple of terms. First of all, to diagnose means to identify a problem or disease, and an intervention means to fix a problem or disease. Then after that, I have the major anatomy, and this is just kind of it listed in words, and so you will want to refer back to this when we get to looking at the pictures. And then after the anatomy, then I go into each one of those diagnostic studies in a little bit more detail and talk about each one of them in a little bit more detail. Okay, so first we will talk about the anatomy. And so we start with the aorta. And so here we have the aortic valve, and of course blood is coming through that aortic valve through the left ventricle, which is roughly there. And so blood's going up through the aortic valve into the aorta. And from the aortic valve to the first branch off the arch, that is considered the ascending aorta. So the first segment of the aorta is the ascending aorta. The first branches off the aorta are the right and left coronary arteries. So here's the right coronary artery, here's the branch off the left coronary artery. So those are considered the first branches off the aorta. However, the first branch off the aortic arch is the brachiocephalic. So the aortic arch is from the brachiocephalic artery to the left subclavian artery. So the three branches off the arch then are the brachiocephalic, the left common carotid, and the left subclavian. So then from the left subclavian down to the diaphragm is considered the descending thoracic aorta. So once you get below the diaphragm, then now it's called the abdominal aorta, once we're below the diaphragm. And from this view, you can't really see it, but the first ventral branch, so ventral meaning coming off forward, like to the front, is the celiac artery, and it's about here. Just below that is the superior mesenteric artery. And the branches that you can see and spot right away on an AP of the abdominal aorta is the right and left renal arteries, and those are the arteries that feed the right and left kidneys. So here's how I do it. You got the right and left kidneys, the right and left renals that feed the kidneys. Above those renal arteries is the superior mesenteric artery. And then below the renals is the inferior mesenteric artery. And then above the superior mesenteric artery is the celiac artery. So that is the celiac artery. And so your celiac artery is the first ventral branch off the abdominal aorta. Then it's superior mesenteric artery. Then you've got your right and left renals, which are lateral branches, and then the inferior mesenteric artery. Okay, so as you descend down, then the aorta bifurcates into the right and left common iliac arteries. Here is a lateral view of the abdominal aortic artery, the abdominal aorta. And so again, the first ventral branch is that celiac artery. Just below the celiac artery is the superior mesenteric artery. And then just below that are the right and left renals. But again, those are lateral branches, so you're not going to see them on a lateral view. But they would be, let's just say, somewhere in here-ish. And then below the renals then is the inferior mesenteric artery, and it comes off ventrally also. You just can't see it in this picture, however. So that is a very brief overview of the major arteries of the aorta. And as you will get sick of hearing me say this, it just takes a lot of practice. You just have to go over and over and over this. Okay, so we're going to move on now to the 10 diagnostic studies listed. And the first one is the pulmonary arteriogram. And so that is an arteriogram of the pulmonary arteries. And so what you need to remember with this is that the pulmonary arteries are deoxygenated, and you have to access the pulmonary arteries through a vein. So it looks like in this picture they have accessed it through a subclavian or possibly a jugular vein. So it's going down into the superior vena cava, it's going now into the right atrium, right ventricle, and then up through the pulmonary valve, and it's sitting, so the catheter is now sitting right about here in the pulmonary trunk or pulmonary artery. They inject the contrast, and then contrast goes out to the right and left pulmonary arteries. So this is another example of a pulmonary arteriogram. The image is inverted, meaning that the contrast is now showing up black instead of white like the other picture. But anyway, this looks more like a femoral approach. So again, they access the femoral vein, and then again went up the up the vena cava, through the inferior vena cava to the right atrium, right ventricle, through the pulmonary valve, into the pulmonary arteries, injected contrast, and then that's when it goes into the right and left pulmonary arteries. So again, this is all a venous system, and so that's extremely hard to remember, but yet very important. So this picture kind of shows you, this drawing kind of helps you visualize it. The catheter is going up into the inferior vena cava, into the right atrium, right ventricle, pulmonary valve. So the catheter is sitting right about here in the pulmonary artery, injecting contrast, and then contrast is going out the pulmonary arteries, both the right and left side. So the main reason a pulmonary arteriogram would be done is to look for a pulmonary embolism. So pulmonary embolism is when a thrombus, which is a blood clot, travels from a vein somewhere else in the body and travels to a pulmonary artery. So this picture is kind of showing you, a blood clot maybe coming from the veins of a leg. That blood clot's traveling up the superior vena cava, right atrium, right ventricle, into the pulmonary artery, and then here it's showing you this blood clot is traveling down to a smaller and smaller branch, and so it eventually kind of gets stuck and causes a blockage, which is an occlusion. The next diagnostic test that is listed is the aortogram, and this of course is just a chest x-ray, and it's showing how the aorta is placed in the body as visualized on a chest x-ray. In x-ray school we learn about the aortic knob, and so it's just interesting to understand that the aortic knob is actually formed by the aortic arch, and so this is kind of what it looks like on a chest x-ray. And then here's a good example of what an aortogram looks like on an x-ray, and then here is a good picture, a good diagram of what the aorta looks like with a catheter placed in it. So this picture is really good at demonstrating, again, the aortic valve, the ascending aorta. You don't really see the right and left coronary arteries come off very well, but they're there. Then you've got the aortic arch, and so it's very important to know the three branches off the aortic arch, and they are the brachiocephalic artery, then the left common carotid, and then the left subclavian artery. Another great thing about this picture is that it goes ahead and shows that, so you've got your brachiocephalic, and then it goes ahead and bifurcates into the right subclavian and the right common carotid artery. And then another interesting and very good thing about this picture is that it goes ahead and shows you also the vertebral artery coming off superiorly and the internal mammary artery coming off inferiorly, coming off that subclavian artery. This picture is also good at demonstrating, showing the catheter going up the aorta, rounding the bend, rounding the aortic arch, and the catheter being placed here at the root, or 1 to 2 inches, superior to that aortic arch for the injection of the aortogram. This is another good picture demonstrating the aortic arch showing you the three branches off that arch that are important. Also, you need to know when the brachiocephalic artery comes off, you need to know that it bifurcates into the right subclavian and right common carotid. This is a good picture showing you how the vertebral comes off superiorly. And then it doesn't show it in its full extent, but you can see this little nub right here. That is demonstrating the internal mammary artery, which is very important. And then it goes ahead and demonstrates this subclavian artery going all the way down the arm, and how at about the elbow area it bifurcates into the radial and ulnar artery, which of course the radial artery is important for us as well, with more and more studies being done via the radial approach. So this image is good for studying the artery anatomy. Okay, so moving on a little bit into diseases of the aorta, why we would be doing an aortogram. First, there is an aneurysm, which an aneurysm is just an abnormal bulging of an artery. So this could be of any artery, but we are specifically talking about the aorta at this time. So this is showing you what a thoracic aortic aneurysm might look like. A dissection is another type of pathology that we might be doing an aortogram for. A dissection is a separation of the intima, which is the inner layer, from the media, which is that muscular middle layer. And so here you can it's demonstrating there's a tear in the intima. There's a tear in that inner lining. And so because there's a tear, now blood can actually run into the media layer of the aorta. And so that's where we get what's called a true lumen, which is the true lumen that's lined with the intima. And then you have the false lumen, which is where blood can run into this, it makes its own cavity, it makes its own pathway. And that can happen if the blood vessel dissects, as it's showing you here. Then you have coarctation of the aorta, and this is a congenital narrowing of the aorta, meaning this is something that's present at birth. And, depending on the severity of it, some people have this all their lives and don't have any problems. Some people have problems, right away after birth. Some people, live with it a normal life for a long time, and then bam, one day they all of a sudden start having problems. So it just depends on the severity of it, and each case is different, but the main thing to understand is that this is congenital. This is not acquired. So this is not something that lifestyle or anything like that contributes to. It's just something. It's a common, somewhat common defect of the aorta, just congenital, meaning it's present at birth.